Occasionally, you will have T cell foci within the spleen. These T cell foci are more appropriately referred to as periarteriolar lymphatic sheaths, but remember they need special chemical stains to distinguish them. So you could just call it white pulp, you could call it a follicular area, whatever you want. If it has a germinal center, you can call it a secondary follicle, etc., etc. Within the spleen, remember, one of the spleen's main jobs is filtration of the blood. How is it filtering the blood? Well, the answer is it has these very specialized capillaries called sheath capillaries. And these sheath capillaries are surrounded by macrophages. And so here's a layer of this macrophage cuff or sheath surrounding these capillaries. The sinusoids within the spleen are capillaries which allow blood to percolate through the spleen. And these vessels are lined by a special type of endothelial cells called stave cells. So here we have some stave cells lining those capillaries, the sinusoids. The palatine tonsil, another lymphoid organ which looks a little like sounds like lymph node at first. But if you look closely, you see that on the surface of the lymph node, it has a skin-like covering. It has a stratified squamous epithelium over it. So anytime you see that thin, delicate skin-like covering, you know it's going to be a palatine tonsil. It rests in a very delicate connective tissue hemicapsule, and it often has these very thick spaces or cracks within it called tonsillar crypts. Diffuse lymphoid tissue, one of the most organized, or the most organized of the diffuse lymphoid tissue is the appendix. Basically looks like so many aggregates of lymphocytes. You may see follicles. They may have germinal centers. They'd be secondary follicles. More active in children. In the adult, it becomes vestigial, just like the thymus. Loosely aggregate. Why did I lose? Oh, anyway, I've lost part of the title. Don't go on. These aggregates of lymphocytes throughout the gut can be referred to as MALT, mucosa-associated lymphoid tissue. If they're in the gut, you can also call them gut-associated lymphoid tissue, or GALT. If they're in the respiratory system, you can call them bronchiolar-associated lymphoid tissue, or BALT. And they look like aggregates of lymphocytes. And they're usually within the lamina propria, that submucosal region. The specialized type of MALT is the Peyer's patch, which histologically looks just like all the other MALT. The important thing about a Peyer's patch is that instead of being a B-cell aggregate, these are T-cell aggregates, which you wouldn't know unless you did special immunohistochemistry. That brings us to the respiratory system. So the flora, it's lined by mesothelium. Who cares? Upper respiratory system is lined by pseudostratified ciliated columnar epithelium. You should know what that looks like. It has numerous goblet cells within the epithelium, and also abundant seromucous glands within the submucosa or lamina propria, which are of course providing a mucus layer that is carried on the cilia of the ciliated epithelium. In the upper respiratory tract, the larynx is the voice box, has the epiglottis. It houses the vocal cords. Remember, there's true vocal cords and false vocal cords. The false vocal cords are located superior and lateral, so they're up here and over here, whereas the true vocal cords are inferior and medial. They have a different type of epithelium covering them. So there's a respiratory epithelium covering the false vocal cords, whereas the true vocal cords have a squamous non-keratinized epithelium over them. Then we have differential innervation by vagus nerve, blah, blah. As we go a little deeper, you can see the trachea. The trachea is supported by cartilaginous rings, a pile of cartilage. These are C-shaped rings. Once again, you can see abundant seromucous glands, both outside of the trachea and within that lamina propria there. You can see the pseudostratified ciliated columnar respiratory epithelium. In the region between the ends of those C-shaped rings, we have a connective tissue intersegmental membrane, and within the middle of that membrane, we have a smooth muscle, the trachealis muscle. That's just a close-up of the epithelium. Bronchioles, unlike bronchi, lack cartilage support. So when you look at a bronchiole, you see that nice respiratory epithelium, but no cartilage. Instead, you see a little smooth muscle for support. Commonly, you see adjacent to that bronchiole a blood vessel and arteriole, filled with blood. When you get to the smallest of the branches of the bronchiolar tree, we have a terminal bronchiole lined by respiratory epithelium, which becomes progressively thinner and more cuboidal with the addition of things like claricels and alveoli. So this now becomes a respiratory bronchiole because you can see individual alveoli off to the side in this region. The terminal branches then are known as alveolar ducts, which are lined by these abundant alveoli. So the alveoli off to the side. Of course, the alveoli are lined by a nice flat squamous epithelium. Here we have that thinning of the respiratory epithelium becoming more cuboidal with the addition of these claricels as secretory cells, which produce lipoproteins as part of the surfactant layer. And you can see the normal ciliated epithelial cells here. The alveoli themselves are lined by flattened epithelial cells called type 1 pneumocytes. And of course, their job is to provide a very thin, moist membrane for gas exchange. So they make up the walls of the alveoli, or the alveolar septum. Connecting the lumina of these alveoli, we have these alveolar pores, which just allow gas exchange between individual alveoli. Scattered throughout the alveolar surface, we have very small numbers of type 2 pneumocytes. These type 2 pneumocytes are larger cells which project into lumen, and their job, like the claricels, is to secrete surfactant. It's very high in phospholipids, and this stuff basically decreases surface tension, keeps the cells moist, increases uptake of oxygen by the capillary within the alveolar septum. This is a close-up, both a transmission and a scanning view of these type 2 pneumocytes. You can see these lamellar bodies containing phospholipid, and here you can see the phospholipid being expressed on the surface of the type 2 pneumocyte. And lastly, within the lung, you can see fixed tissue macrophages called dust cells. These alveolar macrophages, once again, are phagocytic. They're generally crawling around in the lumen, and they can be fairly abundant, though they're generally present in very small numbers. And that's it. So, good luck. I'll see you next time. Remember, be here on time. Same drill as before.